Today for Carol, we are going to do full field laser resurfacing. Carol's pretty typical of the type of patient we usually perform this procedure on. She's in her 50s, she used to smoke, she likes to tan her face, and she's a history of using sunbeds, so her skin's picked up quite a lot of damage over the years. If we just take a look at Carol's skin up close, we can see she has lines that are present at rest, what we call static rhytids. These are around her mouth, above the lip especially. She also has quite a few deeper lines under the eyes, and on the cheek she has what we sometimes call accordion lines. So she's the classic type of patient who would really benefit from skin resurfacing. There are more gentle types of laser we could use to treat this. We could do a fractional laser resurfacing with the halo laser, which would give her a nice improvement, but it wouldn't get rid of the lines. Carol wants as much improvement as possible and doesn't mind the downtime. So we are going for the gold standard treatment here, which is the full field resurfacing. I start just by marking her face. The reason I do this is that the landmarks all lie in a different position when she lies back in the treatment couch, and we need to understand where the line is between the face and the neck. Full field resurfacing is incredible for the face, but it's just too aggressive for the neck, so we need to be careful about our landmarks. Next, I go ahead and start injecting some local anaesthetic to make the face feel nice and numb. When we've got everything numbed up, the next step is to go ahead and protect the eyes. Because we're going to go right up to the eyelashes and tighten the lower eyelids whilst we're here, we need to place the little metal contact lenses in the eye for protection. First, I add a couple of drops of local anaesthetic eye drops so that she doesn't feel anything. Next, I use a little bit of ointment to lubricate the surface of the shield before I pop it in. Patients are often quite anxious about this step beforehand, but actually most patients tolerate it really well. Now that we have everything prepared, I can go ahead and start passing the laser over the skin. I usually start at the top and work my way down, so I'm going to do the forehead first. And I like to do a couple of passes over the forehead, but we usually don't have to go too deep here. Next, I'm moving down to the cheeks, and I'm starting at the bottom of the cheek and work my way back. Then move progressively up the cheek, stopping just below the eyelid. I vary the number of passes and the depth we go to over the cheek, typically doing more towards the front and lower part of the cheek where there are more static lines. But as we go further back in the cheek, the skin has usually been protected by the hair over the years and doesn't have as much damage, and so typically we don't need to go as deep out the back part of the cheek. Now that we have most of the face done, I move to the lip, and this is where I typically go the deepest. I usually go as deep as I safely can go in the lip, since this is the bit where the lines are usually the worst. For Carol, I'm doing 6 passes at 100 microns each, so going down to a depth of 600 microns, which is the deepest level you can safely get to. Some doctors do go deeper than this, and you can do that, but when you go deeper, you increase the risk of causing scarring, so I always stop at 600. If we don't get rid of all of the lines at 600, I would rather come back and do a small touch-up than try and push it too far and increasing the risks. Next, we do the lower lip and the chin. Typically don't go quite as deep in the lower lip and chin because they're usually not as badly lined, although it really depends on the patient. And finally, we finish off around the eyes. The eyelids, I vary the settings a bit and start adding in a little bit of extra heat so that as well as getting the resurfacing, we also get a bit of skin tightening, and I use these settings on the upper eyelids as well as the lower eyelids. And for the very last finishing touch, we just do a couple of light passes over the nose. After the procedure, we cover the face in Vaseline. Carol is also going to take some antibiotics and some antiviral medications for the next week to help reduce the chances of infection whilst we wait for the skin to grow back. We'll see her back in the clinic daily to track her progress and make sure that she's healing nicely. The first few days are always the toughest because you have to watch the swelling get worse before it starts to improve. Most patients start to feel a bit better around day 4, 5, 6 when the skin starts to reappear and the swelling is coming down. By around day 10 to 14, the skin is usually healed enough that most people can get back to normal with the help of a little makeup, although full healing takes about 6 months.